Ever wondered if your lifestyle could be quietly increasing your risk of heart disease? Many people think they know about cholesterol, but in reality, they don't realize just how dangerous certain habits can be. Today, we're breaking down the basics of a condition that affects millions and yet goes undiagnosed until it's a major problem: hyperlipidemia. This isn't just a medical term, it's the silent buildup of fats in your blood that, if left unchecked, could lead to serious heart issues. Let's make sure that doesn't happen to you. What are lipids, and why do they matter? Lipids are fatty substances in your body that play critical roles. Think of them as the body's reserve energy tank, the insulation against cold, and even as shock absorbers for your organs. In normal amounts, lipids, like cholesterol and triglycerides, are essential to keeping our metabolism and overall health on track. But when lipid levels get too high, especially cholesterol, they start to pile up in the wrong places. Imagine these fats coating your blood vessels, slowly restricting the flow of blood to essential organs. It's like trying to water your garden with a hose that's full of gunk. It's inefficient and potentially dangerous. Hyperlipidemia versus hypercholesterolemia. What's the difference? Here's where it gets specific. Hyperlipidemia is the broad term that means there's an excessive amount of fats, or lipids, in your blood. Hypercholesterolemia is one type of hyperlipidemia, and it refers specifically to high cholesterol levels. Cholesterol itself is a fatty, waxy substance. Your body needs it, and your liver produces just the right amount. However, if your diet includes lots of high-fat foods, that number rises, and the liver can't keep up with breaking down all the extra cholesterol. As a result, it builds up in your arteries. This can lead to atherosclerosis, a condition where cholesterol clings to artery walls, creating plaques that narrow the passages where blood flows. Causes of hyperlipidemia. What are you putting into your body? Understanding how lifestyle plays a role in hyperlipidemia is key. Here's how some common lifestyle factors can lead to excessive fat buildup in your blood. 1. Diet. Saturated and trans fats are the big culprits. Found in things like red meat, butter, fried foods, and packaged snacks, these fats raise lipid levels and increase your cholesterol. 2. Exercise, or lack thereof. Regular physical activity helps your body manage lipid levels. Without it, excess calories often turn into triglycerides, the most common type of fat in the body, which gets stored for later. 3. Alcohol and smoking. Both habits have a negative impact. Alcohol, in excess, raises triglyceride levels. Smoking impacts how the body handles cholesterol, lowering good cholesterol and making it easier for plaques to form in your arteries. 4. Medications and health conditions. Certain medications, like beta blockers or corticosteroids, can increase lipid levels. Health issues such as hypothyroidism, diabetes, or even genetic conditions can also influence how your body manages fat. 5. Age and genetics. Genetics play a huge role. Familial hyperlipidemia can be passed down, meaning your body is predisposed to high lipid levels. Age also matters. Men under 55 and postmenopausal women are at higher risk. LDL, HDL, and the role they play. Not all cholesterol is the same. You've probably heard of good and bad cholesterol. LDL, low-density lipoprotein, known as the bad cholesterol. LDL carries cholesterol to your cells. When LDL is high, it deposits cholesterol along the walls of arteries, contributing to plaque buildup. HDL, high-density lipoprotein, this is the good cholesterol. HDL transports excess cholesterol from your arteries to the liver, where it's broken down. The higher your HDL, the more protected you are from heart disease. A blood test called a lipoprotein profile can determine your LDL and HDL levels. If your LDL level is over 130 mg/dl with other risk factors, or over 190 mg/dl by itself, doctors may diagnose you with high cholesterol and discuss potential treatments. Real risks of high cholesterol. What's at stake? If high cholesterol persists, your blood vessels narrow. Imagine if the blood flow to your heart was cut off, even just a little. This restriction can lead to chest pain, heart attacks, or even strokes. When plaque continues to build, you're looking at possible conditions like coronary artery disease, peripheral artery disease, heart attack, stroke. Tackling high cholesterol and hyperlipidemia, lifestyle changes you can start today. Taking control of your lifestyle is often the first step to reducing your risk. Here are some practical ways to keep cholesterol in check. 1. Heart-healthy diet. Focus on lean meats, low-fat dairy, and healthy fats from sources like olive oil and avocados. Avoid saturated fats and trans fats. Choose whole grains, fruits, vegetables, nuts, and legumes. These foods not only help lower LDL cholesterol but also support overall heart health. 2. Regular exercise. Get moving. Aim for at least 150 minutes of moderate exercise each week. Activities like walking, biking, and swimming can raise your HDL levels and keep your blood vessels flexible. 3. Quit smoking. Quitting smoking isn't easy, but it's incredibly beneficial. It can improve blood flow, raise HDL levels, and lower your risk of heart disease. 4. Maintain a healthy weight. Losing even a small amount of weight can help decrease your lipid levels and improve your heart health. 5. Manage stress and get enough sleep. Chronic stress and sleep deprivation can raise your cholesterol levels. Incorporating relaxation techniques and ensuring you get 7-9 hours of sleep each night can help your body regulate cholesterol more effectively. 6. Limit alcohol intake. Excessive alcohol raises triglyceride levels. It's best to consume alcohol in moderation, about 1 drink per day for women and 2 for men, or speak with your doctor about your limits. Medications, sometimes necessary, not always the answer. If lifestyle changes aren't enough, your doctor may prescribe medications like statins. Statins help lower cholesterol by blocking a substance your body needs to make cholesterol. Other drugs may be used based on your specific needs, but it's essential to consult your doctor about potential side effects and benefits. Wrapping up, managing your cholesterol doesn't have to be overwhelming. By understanding what causes high cholesterol and the ways you can bring those levels down, you can take proactive steps to protect your heart and your health. Remember, hyperlipidemia and hypercholesterolemia are conditions you can control, and the choices you make today could save your life tomorrow. So take a moment to evaluate your lifestyle. Are you making choices that help your heart, or are you taking chances? It's never too late to make a positive change for your health. Consult with a healthcare provider about your lipid levels and take control of your future today.